Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're excited to be back in the Studio A of St. Tammany Parish Government. We've been gone from here for quite a while because of the worldwide pandemic and COVID-19 and its impact on our local community. Community health is our focus today at our first episode back on Healthy Living. We'll be talking about a community advisory council focused on a healthier North Shore. We'll speak first with Ann Pablovich. Ann leads the organization, the council, and we will speak with Dr. Michael Hill, who is St. Tammany Health System's foremost authority on public health and population health. And then we will talk with Nick Richard, who heads up NAMI St. Tammany, and that mental health component is so important to community health and wellness. So we'll start with Ann Pablovich. Ann, thank you so much for joining us.
Thank you for having me.
We're excited to be here. We've got our masks.
Absolutely.
We've got our 6 feet of social distance. We've had our temperature checked.
Screen.
We're
Yes,
doing
ma'am.
everything right, and yay, we get to be out here like humans talking to each other.
Absolutely.
Thank you for being here. So let's start just with, talk to me about this community health initiative.
Yeah, so I just started with the health system earlier this year, and it is kind of a new priority, a new focus for St. Tammany Health System and getting out into the community. The purpose of this advisory council is to kind of guide the initiatives that we're hoping to implement. We want to make a change in how our community is rated in terms of our health status and in terms of the chronic diseases that we have, that we battle. And so there's a few things that we're hoping to implement. We've had our first advisory council meeting earlier last month and in September. And so, yeah, we're excited to kick it off.
Okay. So I hear you saying, you've seen Louisiana at 49th and 50th. We're excited that, we've at least made it to 44, so a little
Yes.
progress there.
Absolutely.
And of course, St. Tammany and Washington parishes being the healthiest and the least healthy in our entire state.
Absolutely.
And so what we want to try to do is gather some folks together. So who are the people? Tell me who's on this committee.
So the council is comprised of community stakeholders and leaders across St. Tammany and Washington parishes. So we've got our healthcare leadership involved. We have our elected officials that are involved, and then a number of nonprofits that really are integral in community health initiatives and what their focuses are primarily on.
So you have people from St. Tammany Health System, from Oxnard, North
Absolutely.
Shore, and then certainly elected officials, and then civic organizations too, like the Business Council, the Chamber.
Absolutely. The North Shore Community Foundation, NAMI, as you know, Nick
Right,
Richard's
we'll be
going to be
talking
here.
with Nick
He's on the
shortly.
council. The food bank, different
Absolutely.
organizations that have some component that can contribute to improving health in our community.
Great. And then, of course, representation from not just elected government, but also government offices like the Louisiana Department of Health Region 9.
Absolutely.
Wonderful. Okay, so we know that the initiative is looking at St. Tammany and Washington. We know a little bit about the kinds of folks who are on it. Tell us a little bit about what your primary focus is, or what it is that the initiative is hoping to do.
Sure. So we know not just St. Tammany, but Louisiana struggles in our response to a number of chronic diseases. Cancer and heart disease are really problematic for our community, and there's a number of factors that contribute to that: obesity, lack of activity. We don't have a huge active community, and then smoking and alcohol use are really heavy contributors to most chronic diseases. And so this initiative is really, there's 3 primary focuses, and that's education, early detection and prevention, and then connection to resources. And so by pulling together all of these leaders and stakeholders in our community, we're hoping that they can help us address how we can tackle some of these challenges. They can give us different perspectives and things that maybe we haven't considered as a health system. A different perspective can sometimes help bring awareness to another challenge that's associated with this problem. And so, so those are the 3 primary components: is education, early detection and prevention, and then connection to resources.
Great. Education, early detection, and connection with resources.
Yeah.
I love it because we're out there educating the public about things that they can do to keep themselves healthy,
Absolutely.
take care of themselves, and then early detection, of course, we know that the way to good health is to find things early, take care of them before they become serious.
Absolutely.
And then connection with resources, absolutely such an important factor. When we think about folks who are underserved, maybe live far from care or don't have insurance or don't know what their insurance may or may not cover.
It's a struggle. One such collaboration that is already underway is a partnership with the Cancer Center and this North Shore Food Bank, where they provide food boxes to some of our oncology patients. And so, you know, when you're in the midst of treatment from a diagnosis of whatever sort, you know, sometimes it can be hard to pay for that treatment, pay for your deductibles, your co-pays, and then also put food on the table for your family. So having partnerships with these community-based organizations, we've got a huge support in our community from all of these organizations, but tying them together and making known, you know, when there's a struggle or when there's an issue that somebody needs help with, you know, we're all going to be better for it in the end.
That's an outstanding example of your connection to resources. The third one that you mentioned, that North Shore Food Bank has a pantry in St. Tammany Cancer Center.
Yeah.
That's just beautiful.
Absolutely.
The middle one that you mentioned, early detection, you have some really neat ways that you're doing early detection. There's a comprehensive screening opportunity.
Yeah,
Can you talk about that?
Sure.
One?
So we have one of the things that we've started to develop is a education and screening program called Health Check 365, and one of the events that we've done, we've had 2 sessions so far, and it's a comprehensive health screening. Just as you said, it covers 10 screenings, from skin cancer screening, head and neck cancer screening, a lung cancer screening through low-dose CT. You know, you go through the gamut to having cholesterol labs done, and so it's a cash pay price. So it doesn't matter if you have insurance. It doesn't matter if you have a primary care physician. You can participate in this event, and it's been really helpful. It's a consolidated event, so you get 10 screenings in about an hour and a half. It's very efficient, so you're not spending a lot of time waiting in doctors' offices or waiting, you know, to have these procedures or screenings done. And so it's been a great success so far. We're trying to do them every 2 months. And so it's geared to the busy working parent that doesn't have a lot of time to take out of their day to tend to their health.
And kind of get everything checked out and
you get
follow up what needs to be followed up and feel confident about everything that came back happy.
Absolutely.
That's wonderful. And then education, of course, we're out in the community all the time with that. Can you talk to me a little bit about why St. Tammany Health System and Ochsner, why hospitals take care of the sick?
Yeah.
So talk to me a little bit about why we want to involve members of the community and really sort of steer this good health initiative.
Yeah. So you mentioned earlier prevention is key. You know, if people know better, then they can do better. If you know that having a healthy diet and exercising could prevent you from getting a specific type of cancer, then you might make it a bigger priority. It might be less about looking good and more about taking care of yourself. 90% of what we as a nation spend on healthcare, I think it's $3.5 trillion in the last year, is focused on chronic disease, and so in the treatment of that. And so if we can prevent some of that from happening, then, you know, we're going to have healthier community
overall.
Healthier individuals. Yeah, it's going to be a win for everyone.
That really is neat, because the next person we're going to speak with is Dr. Michael Hill, and he's going to talk to us about population health. And so it's really exciting to see these 2 health organizations coalescing and gathering around the community and developing this community advisory council.
It's exciting.
Healthier North Shore. I'm so excited. We'll sit around talking about our Healthier North Shore a year from now.
I hope so.
And thank you so much for coming in.
Thank you for
We're
having
excited
me.
to be talking about this.
Yes, ma'am. Thank you.
Up next, we'll be talking with Dr. Michael Hill from St. Tammany Health System about the population health component of our Healthier North Shore. We'll be right back.